So before we close this public event, I'm very glad to have our host here, Maya, from the Latvian University in Riga. And together with me, we will try to animate a discussion with you. So now we want you, the audience, online today with us, to give us your feedback on how we might perceive our very wide array of activities as a fragmented community, and that's how the European Commission is perceiving it, and this is how we ourselves see that community and what we can do to bridge those gaps.
Thank you for kind introduction. My name is Maya Radziņa and I come from Riga, Latvia, and I'm a radiologist. And this roundtable discussion is dedicated to the understanding how to bring together the understanding and also the common points in between the end user, so any clinical doctor, until the real patient clinical use of radionuclides and also radiopharmaceuticals, and what we can do in reaching out also to the research institutions, rather than we sparsely know about the novelties. So the PRISMAP project main goals are to join these interests, and nevertheless, we are so interested in the research and in the patient outcomes, we cannot move further on without manufacturers, meaning the industry. And therefore, this is absolute triangle that we need. And let me show and share one slide with you that has been coming up from the survey so far. We have also advertised it on the website, and you see with a red arrow marking the spot of a red square there that you should click on, and you have an access to that survey. So all of those countries that were responding to the survey, it was launched in February to the public access. You see already the green areas are the respondent covered, but there are quite vast majority of the areas that we actually don't know. Probably we are not aware of the issues that you have, or maybe the needs and interests that you have also in upcoming years. So this is one of the ways how we can maybe bring together this fragmented aspect of all the involved parties. But we are open to the discussion from the audience about what are the other ways, or maybe how we could build a beautiful map that everyone could see. Where is the radioisotope, how we can receive it, so transportation logistics, what kind of licenses and the pathways are available. Shall we actually bring the patient closer to the production site, or maybe there is already a clinical facility? Maybe the patient's specific, maybe rare diseases could be involved in some joint also research projects, clinical trials. So that would be an ideal world that PRISMAP Consortium sees, right?
Yeah, those are all very exciting prospects and ideas that you're bringing up. So what do you think online? Feel free to communicate via the chat, or to take the mic if you want to say something in particular.
Okay, so I see that Clemens from audience here have a comment, so I will pass the microphone on.
Well, just a proposal also for stimulation. You've seen on the map that we have some areas of who may are not as much aware of PRISMAP, and I mean, my comment would be, we are now also very much have seen projects that are very much related to basic research, and maybe some of these areas do not necessarily have strong groups in basic radionuclide research. But as Maya pointed out, I mean, another way of use of PRISMAP radionuclides is more towards also clinical applications. And I know there are many groups in these areas being active clinically and involving in theranostics and so on. So this is also maybe not the very short-term application of PRISMAP radionuclides, but that's also what we try to facilitate in our work package with the harmonization and standardization issues, to provide some support to do this translational work. So.
Yeah, thank you very much, Clemens, for this insight. I see that Beatrice has raised her hand. So you have the mic.
Hi, can you hear me?
Yes, yes, we do.
So I was thinking about the, as I told you before, I heard about this PRISMAP project because of the German team. So I think, but when I was talking with other colleagues here in Spain, some of them were quite interested on this kind of consortium. So, but I think the main problem is most of the radiochemistry or studies in nuclear medicine are just preclinical. We are quite traditional in the clinical field about nuclear medicine. We only work with FDG and a couple of treated more, but it would be, but I think there are already like 4 or 5 groups here in Spain that could be interested in this kind of partnership. And maybe, so I'll be more than, so we have like a national group in molecular imaging. And I will try to, but it's for young researchers, but still I will share that with that. But maybe, presenting this PRISMAP consortium in other conference, like the one that you showed before for the ENM, like, but most of us, for example, attend to this ESME conference, for example, and I know for sure that most of us are always in those kind of meetings. So that could be also a nice platform to share. I know for sure that last year, for example, they used one of the spots to present cost actions, for example. I was participating in a couple of them. So they offer sometimes spots to announce or to share other consortiums regarding, the field of molecular imaging and radioisotope and radiochemistry. I know this is not a clinical audience, but still, I think many groups, not only from Spain, I mean, a lot of groups from Germany, from Italy are also attending to this kind of, to that specific conference. So could be also an option if you want to, to show in other public events, let's say like that. Would be a nice place also to spread the word.
Okay, thank you very much for the input. Indeed, we started with ENM because, well, nuclear medicine is naturally the core, but definitely molecular imaging is a big part. So ESME is another big conference that we should definitely target with our activities, as well as those about production. So I know a lot of my colleagues in the production field are going to the accelerator-based production and other radioisotope production conferences. So we will try that way indeed. But on the other end, if you now speak with your colleagues, you can raise also awareness to them about what we're doing and let them know that they can follow us and listen to what we have to say, because maybe they can find interest there as well.
Yeah, absolutely. Yeah, actually, they asked me like to tell them when was the next call, so I'll be more than happy to tell them, because at least 3 or 4 of them were already interested on this call. So more than happy to help with that.
Wow, that's very exciting.
We are pleased to hear that. So there are a few raised hands. So Jean-Michel Zoga, right?
Jean-Michel, did you want to say something?
Good morning, everyone. No, I never asked for telling something.
Sorry, we must have.
You have some... No, okay, but now I have. So it's a very nice topics. In fact, just because okay, I am more specialist in nuclear physics, and now I am working in a laboratory close to Paris, which is making this IRM and NMR and PET scan. So it's we have here lots of radiochemists and radiopharmaceutical also. And I think now I will share this presentation of today with everyone here, and maybe we will hear from us soon. And the aim is to propose something for the second call, and I think this will be nice that my lab participate to this consortium and to the PRISMAP. Okay, so thank you very much.
Well, thank you. We are. It's very nice to hear that this has sparked new ideas and new intentions. Also, as was mentioned by Thierry, don't hesitate to contact the help desk if you have any questions or if you want to inquire whether your ideas are sound with respect to expectations and so on. We are always ready to help and to provide feedback also during the preparation stage to make sure that you have the highest chance of success with your application.
Yeah, thank you. Yeah, we will contact you for sure. Thanks.
Great to see you also. And is there anyone also from the audience here who wants to comment a bit of that fragmentation and how to bring the idea of research to the industry and then actually bring it to the clinical use? Although we know that radionuclides, radiopharmaceuticals are a bit more sophisticated, yeah, in terms of licensing and also in terms of use. Anyone? You can either Mathis Sevenois have raised the hand, I see.
No, there is no hand. Yeah, wait.
The lowest, Mathis.
No, it is the mouse.
Ah, it's mouse. Ah, okay.
Yeah, we have a nice effect on the screen that there is a cursor on the screen that looks like a raised hand from Zoom. So we thought that Mathis Sevenois wanted to say something, but it seems that it was indeed just a cursor. Unless you do want to say something, you are definitely welcome to.
And Mikhail, okay, we will bring the microphone to you.
Michael Jensen from PRISMAP DTU. One of the important things to me in PRISMAP is, okay, we are introducing and providing novel day 1, day 2, day 3 radionuclides, primarily for research. I would like to point out a very important feature of PRISMAP, that is scalability. We shall predominantly work on systems that have a long-range possibility of scaling into wider spread clinical use. It doesn't help if we demonstrate that we can help or cure or diagnose a given cancer if we can only give it to 10 patients in one territory. And the scalability of PRISMAP is narrowly coupled to something that we haven't touched very much upon, but which is central to what we do. The mass separators for hot radionuclides is really at the core technology. And that's, I would just like to point out, we have more in our arsenal than we are just showing you here. It's only that the mass separator technology is still being developed. We are not promising you something that cannot fly long term. So that was my remark.
Okay, thank you, Michael. Indeed, the mass separation is at the core of our activity so that we can provide the necessary purity in those novel radioisotopes we are preparing. This is why as well we do have forward-looking and future-looking components to our program, where we are collaborating with different institutions across Europe who are investing now in that technology and looking into new prospects. Some of them you might have heard of before. There is, for example, the Isolat Mira facility at the Belgian Nuclear Research Center, SCKCEN, where they are currently in the design phase and almost starting the construction. For those of you who are interested into this, be aware that we are planning a workshop about that facility with a dedicated thematic topical session on the need for the medical radioisotope community from that new facility. We will shortly post the link into that event in the chat so that you may look into it if you are interested. Meanwhile, we have also heard of other projects at partner institution. For example, the Paul Scherrer Institute and the Aronnax cyclotron are looking into feasibility studies and seeking designs into building similar facilities on their site, so that we hope in the future to be able to enhance our capabilities, scale up the production, and hope that by the time that the preclinical research is completed, we are also able to scale up the production to clinical needs.
And also I want to emphasize a moment that this is one of the pathways how we actually can know the ways you already collaborate. So in terms of a survey responses, we really appreciate if already existing collaborators and also manufacturers are mentioned in your responses, because then we can provide to the other users possibility to know that these industries are there. And if there are also industry representatives watching us online today, you are also kindly invited to take the participation and expose your applications, your possibilities, and also your future plans, where the researchers could actually be interested in and even foster it, or I don't know, increase the volume of your products. Therefore, we are coming very close to the end of this public event. And is there any words that Thierry wants to add as the final closure to the PRISMAP Consortium public event?
So I really hope you enjoy. I really definitely enjoyed it very much from a consortium perspective, to have the possibility to listen and to see all this excellent project which will be implemented, as well as you have seen the discussions we had with, for instance, use of this isotope in the clinical settings, regulations at the European level. So we are, of course, we know that the Joint Research Center, for instance, is really as a mandate actively develop activities. This Joint Research Center, this is these laboratories from European Commission across different sciences in Europe. So they're really an active part of the European policy. But PRISMAP, as well as a European funded project, we really believe we can provide some input in this direction. And if you have not done so, please as well register to the user forum. This you can access through the prismap.eu. Promote PRISMAP as well amongst your colleagues. This as well, if you have innovative industrial groups, don't be shy. These services can as well serve if you have advanced research project in small academic spin-off in a kind of industrial settings. This is as well an offer for you. and interact with us. Use the help desk. We are really looking forward to promote. We will renew this public event probably at 6 months basis, and probably even more. We have training. And really, if you have events, if you think you have trainings, conferences where you believe we may indeed promote a bit this line of research, this new ways of using these radionuclides, not anymore in bilateral collaboration with a unique facility, but then repooling this, and you see the strengths it has. Please, if you believe in this, please promote this as well amongst your networks. Thank you.
Okay.
Thank you, Thierry.
Thank you indeed.
Thank you, Thomas.
Thank you, Maya. And therefore, we hereby close this session. Thank you very much for attending. On top of the next public event, we will also probably be organizing short webinars on different topics of relevance to PRISMAP in the course of the summer and in the autumn. And those will be, of course, informed via our website, our social media, and via the user forum. We look forward to seeing you all at different events, hopefully in person in the future, and wish you a very good day.
Bye-bye, everyone.